Okay, so this is the third video for the external and internal directional and locational anatomy part 1. Okay, so in addition to directional terms, we give special names to various visible points or regions on the surface of the body, and there's a really long list of anterior and posterior landmarks. For now, we'll focus on those that potentially will be most familiar to you. And again, we'll create drawings to help us. And also, don't worry, I'm not going to ask you to write these in your vocab list. Okay? So our learning target student will correctly be able to identify and use the following external landmarks: abdominal, axillary, carpal, cervical, digital, etc., etc., etc. You can read the list. And then the reason we're going to do this is because external landmarks provide a precise and concise means to convey locational anatomic information about the external surface of the body. And you will be able to correctly identify all external landmarks on diagrams of the body, and you will be able to correctly apply external landmark terms in a variety of question types requiring knowledge of these terms. So, for these landmarks, we'll use drawings of anterior and posterior views of the body. These will be official drawings, so please draw your own version of these diagrams on a blank sheet of paper. You can draw them on the same side, or you can draw them on different sides of the paper if you want. We'll use these drawings shortly to illustrate external landmarks. So, for anterior landmarks, you may have some connection to the following terms. And for each term, we're going to draw an arrow to the location and then write in the term. So the first term that we're going to talk about is abdominal, the anterior body trunk inferior to the ribs. Most of you are familiar with where the abdomen is. And so draw an arrow to where I've shown you on the diagram and write the word abdominal associated with it. Axillary, the armpit. The axillary region is important in women's health. Lymph nodes in this region are where cancer will spread first in patients with breast cancer, and so there's a significant medical importance to that. Also, the axillary artery passes right through the armpit. You can probably feel your axillary pulse. The axillary artery comes directly from the heart. The path to the axillary artery from the heart is very direct, and so it used to be in medieval times when people wore suits of armor. Weaknesses in the suits of armor were exploited in the axillary region. A knife to the armpit or the axillary region would cause a patient to bleed out fairly quickly. Carpal means wrist. You've probably heard the term carpe diem, seize the day. Well, the thing that we seize things with is the wrist. So the wrist, you may have heard of carpal tunnel syndrome as well, and this is numbness of the hand due to entrapment of nerves going to the hand in scar tissue related to long-term vibrational trauma to the wrist. And you're all going to have this before you get too much older because of your trauma that you're causing your wrists by the vast amount of typing that you do on your phone and your keyboards. So this often occurs in those who type a lot. Okay. The next locational term, cervical, which is the neck region. Medical programs, you've probably heard of a paramedic placing a C-collar on someone with a neck injury. Make sure you understand that the cervical region, which is the neck, is different than the uterine cervix, which is where cervical cancer occurs, and that's the neck region of the uterus. So don't mix those two terms up. You're also aware that digital refers to fingers and toes, so place an arrow to your fingers on one of the hands and say that that's the digital region. Your fingers and toes are called your digits. Nasal, obviously the region of the nose. Keep placing these on the diagrams. Oral, the region in the mouth. So we missed one. The orbit, the orbital region. Your eye is called your orbit, so this is the orbital region. The region of your kneecap is called the patellar region. You've probably heard your kneecap referred to as the patella, or the ligament that attaches it to the lower leg is the patellar ligament. So the patella, or the patellar region here. And then the region of the pelvis. You can draw an arrow to that, where the pelvic girdle is. The pubic region, I can draw an arrow to that. That's the genital region. The sternal region is the region of your breastbone. And then finally, for the anterior view, the thoracic region is the region of your chest. You're probably familiar with this term as a region in insects. And you will learn about the thoracic cage in musculoskeletal quizzes. Oh, and then finally, umbilical is the region of the navel. This is where your umbilical cord attaches. So now we can go to the posterior surface, the posterior landmarks. You may have some connection to the following terms. We're already familiar with the term cephalic. That's a directional term as well. And so the cephalic region of the body is the head region. We also call that the cranial region, or the cranium. The gluteal region is the region of the buttock. You've heard of the gluteus maximus muscle. For those of you that work out, you know your deltoids are the large muscles that allow you to raise your shoulders. So we have the deltoid region. The lumbar region is the region of your lower back. You may be aware that a lower back support is also called a lumbar support. Maybe you or your parents use that when you sit in a chair or drive. The region of your shoulder blade is your scapular region, because that bone is called the scapula. And then finally, many of you know that the bones of the spine are called vertebra, so this is going to be the vertebral region of the body. And I also have a game that you can play, and this is also on your canvas, but we can take terms here and match them. You can practice this using this game. So you can see this drag and drop kind of game here will help you learn these terms. Okay, so that's going to be it for this part of the discussion. So we'll close this video here, and then you'll have a second part which will talk about the internal body structures, and look forward to seeing that coming out really soon here.